let's do a quick recap of the previous class. So we started with Artava kshaya in the Artava Vyapat. So this is very important topic, because most of the cases you get, whether PCOD or hypothyroidism or any hormonal gynecological cases, most commonly you find, even infertility, including infertility, most commonly you find either amenorrhea or oligomenorrhea or hypomenorrhea. So very common. Oligomenorrhea is one of the most common problem you encounter in your clinical practice. That's why. Okay. So few things about Artavakshaya in Ayurveda. So what is Artavakshaya? It is Uchita Kale Adarshanam. So the periods will not be present. It will not, appear on proper time. Okay. So oligomenorrhea, usually we can correlate it with the oligomenorrhea, where we can say there is the frequency gets disturbed, the interval gets disturbed. So every month there is a period, right? These all we have studied in the introductory part, and other teachers would have also discussed with you. So suppose once in 28 days cycle, if the periods is not happening even after 35 days of the previous period or previous cycle, so then we can consider it as oligomenorrhea. Not just with one cycle, multiple every month, if it is happening very frequently, then Uchita Kale Adarshanam. If it is happening very frequently, if there is delay in the menses on time, if you are not getting, that is one significant symptom in Artavakshaya. Next one is Alpata. Some may get on period on time, but there may be hypomenorrhea, that is reduced flow, or some may have both delayed menstruation along with that reduced flow as well. There can be combination as well, or either of this. So see, if you at the menarche only will have the less bleeding. Some will have 7 days, up to 7 days bleeding. Some will have only 2 days bleeding. That is normal, because their prakriti, vata prakriti, they may be vata prakriti person, and hereditary factor may be there. Her mother might also have the same history, everything. Since menarche it's happening, everything else is fine. The hormonal balance is fine. You need not worry. But if it is acquired one after few years of menarche, suddenly she developed hypomenorrhea for quite 2-3 cycles, if the patient has observed, then you will have to address that. Okay. So sometimes it is also associated with yoni vedana. Okay. Yoni vedana, you can consider it as associated symptom in Artavakshaya. Okay. So in Ashtartava you can find the reference as Kshina Artava Dushti. Okay. So that is covered here. It is simultaneous. Okay. So this all I had already told. It is derived from kshi, which means to cease or to reduce. And according to Charaka, it is related to the word Sanskrit word rasa, that is reduction. Rasa means in Sanskrit it is less or low. Huh? Okay. So this Artavakshaya can be a single disease, or it can be a symptom in any other gynecological disorders. Okay. Any other menstrual disorders. This alone can be a condition, or say for example polycystic ovarian condition, thyroid problems, or any other conditions. It can be a symptom as well, or patient may present with only oligomenorrhea. She could not have she may not have PCO, she may not have any other health issues, but still she can have oligomenorrhea. Okay. So according to Acharya Chakrapani, what he says, if any symptom, if it is not treated for long duration, if it is left untreated, so it can manifest as a separate disease, and it can be, very difficult to manage. So better to treat as early as possible. So oligomenorrhea definition I have already told. So it is bleeding occurring more than 35 days apart. Okay. And remains constant at that frequency, like frequently for 2-3 months, it continuously it's happening. Okay. Then you have to consider. Suppose it was normal earlier. Always consider the previously it was normal. The patient might be getting once in 26 days, 28 or 30 days. But now all of a sudden she will tell, I'm getting 40-45 days, once in 40-45 days. Then it's a concern. Okay. Occasionally don't give significance to just only one cycle, but if it is happening repeatedly, then it has to be considered. Hypomenorrhea, so again the very scanty bleeding, like less than 1 or 2 pads, and it lasts only for 2 days, then it's a hypomenorrhea. So nirukti raktasya pramana hani. So there is pramana hani, the quality of the reduction of the bleeding rakta you can consider. Okay, previously only I have explained all those things. So again, factors responsible, causative factors. Uh, eh, there is no direct reference for this one, Artava kshaya, but what is the pathology considering that, and because Vata Vriddhi is there, and Kapha Vriddhi is also there equally, Pitta is reduced. Okay, so considering that, definitely Mithya Ahara. Nowadays the lifestyle is unhealthy lifestyle. Then Ati Rukshanapana, because Vata Prakopa it will do. Abhishandya Ahara, Kapha Prakopa it will do. Then Asatmya Anna, so which we are not used to it. Suddenly, if you're taking that also. Then Anashana, not eating, vata prakopa. Ati samshodhana, if it can be complication of ati samshodhana panchkarma treatment. Ati samshodhana will again lead to vata prakopa only. So vatakara and kafakara ahara, ati maituna, ati vyayama, ratri jagarana, diva swapna. So these are all vata, either vata kara, and diva swapna is again kafakara. Okay, so next is according to Dalana, he is told also Vegadharan and Manasantapa he has added, other than that what I had mentioned. See, also note here in the previous class also I had told Vyayama or any other symptom, no, sorry, any other causative factor. So if done during menstrual cycle, most of the period, now it is a trend. Workout people are very conscious about the fitness, physical fitness, weight loss, everything. So most of the women go to workouts, especially gym or aerobics. So not just the physical fitness, even they get some kind of that enthusiasm and that motivation when they work out. So because of the stressful life and all, so they feel, some people like they feel pampered, they feel that they are taking self care, so it will lift their moods also. So what they do, they work out even on periods time also, during the menstrual cycle also. That is very very wrong. Following Rajaswala Parichari is very very important, because if you are not following the Rajaswala Paricharya, this will lead to all this Artava Dushti only. So, as the patient, whenever you are getting this one, no, practically, Mithyahara, yes, we are telling in general, Ratri Jagrana, we are telling, but you have to ask the patient when you are taking the history, whether they are doing Vyayama during their menstrual period. Yes, then ask them to stop, understand, make them understand the significance why they should not do vyayama. Even there are certain chemical changes happening in the body. I'll get that reference in the next class, I missed out. Okay, according to modern science also, only athletes, see, they don't have any other option. Athletes have to practice, or they have to perform, they may have some major event. Athletes or some physical activity person related profession, no? They are bound to do that. But even otherwise, normal common people who don't need such physical activity, they also perform during menstrual cycle. One very common uh, you know uh, mithya vihara, we can say, which we people do nowadays. So you should educate them. Even ratri jagarana, they stay whole night, they keep scrolling through social media, they watch Netflix series, Amazon Prime Video and all. So you should educate them, especially during periods. Even on normal days they should not do ratri jagarana. Especially during periods, they should take rest. The causative factor for long duration, makes it has impact on the body. Rajaswala Paricharya, how why patient, why people, why women were told to take rest, you should make them understand. Okay, so this is the Nidana part. Then Sampramti happens at two mechanism. Okay, one is Margavaroda Janya, because of the Kapha Vrita Vata or Kapha alone. What happens, there is avarna of Artava Srotas. So this will lead to Sangha, obstruction and Artava Kshaya. Suppose the patient is obese, Staulia is one of the very common factor. It will Kapha Vriddhi will be there. Vata will also get imbalanced when there is Staulia. So such women, because of sedentary lifestyle, they sit in front of the system for long duration. They will not do workouts. They will indulge in unhealthy, food items and all. So they are unable to take home food. They will eat from outside. So what happens? There will be obesity or overweight. So that will lead to avarana of this Artava Srotas because of that increased kapha and medas and all. So avarana of Artava Srotas and Sangha will be there, and that will lead to Artava Kshaya. So one more Samprapti Vikatana also happens. Some people, they get Artavakshaya because of Dhatukshaya. Okay, so Dhatukshaya Janya Artavakshaya happens, especially Vata Prakriti persons. They are Krusha, they are not obese also, they are Krusha to Madhyama, they are not taking proper nourished food, lot of stress is there. Okay, further increase in Vata. So such people, overactive people, and all, it will lead to, because Rasa Dhatu itself is not nourished. Okay, so further it will not get converted into Artava Upadhatu. And Rakta Dhatu is also not nourished because the previous Dhatu, Rasa Dhatu, is in Kshinavastha. So there is Anuloma. Uttarottara Kshaya will be there. What you say, Dhatus, Uttarottara Kshaya will be there. So this will what happen, the Artava Kshaya, because Poshakamsha of Rasa will not be there. It will not nourish the Artava. So Artava Kshaya will happen. Okay. So again, Ashraya Ashri Bhava also you can correlate here. Okay. So one more thing, when there is Rakta Dhatu Kshaya is there. So Pitta is Ashraya Ashri Bhava, it is related to Rakta. So Pitta also reduces, Rakta also is there is reduction. So Artava Kshaya will be there. Okay. So then next is so Samprati Vigatana in that Gatakas. Okay, dosha is Vata, especially Apana Vata, Kapha is Kledaka Kapha, Pitta is Pachaka Pitta. Then Dushya, Rasadhatu and Artava Upadhatu. And you can also consider Rasadhatu actually here. Uh, and if it is Staulya and all patient, Medho Dhatu also you can consider. Okay, depending on your Yukti. Okay, Agni Mandya, Jatragni as well as Dhatvagni level. Then Srotas Rasava and Artava Srotas. Adhishtana will be Garbhashaya, that is uterus. Okay. So when going back to the modern correlation, so it is a oligomenorrhea. We can correlate with the oligomenorrhea. So where there is infrequent menstrual periods. So this all I have explained in the previous class only. So normal menstrual cycle means it happens once in every 28 days and lasts for 4 to 7 days. So normal period can range from 21 to 35 days. But beyond that, beyond 35 days, and that delay is happening for continuously 2 to 3 months, then you can consider. Okay. Um so why, because see, in oligomenorrhea again the periods also becomes unpredictable. Okay, it may not happen on 35th day also. Some will tell 40th day, some will tell once in 55 days. So there is no defined cycle will not be very much defined or organized, this one. Okay. So hypomenorrhea next is, sorry, so there is incidence around 12 to 15%, they experience oligomenorrhea at some point of their lifetime. Okay, during their menstrual when it is active, menstruation is happening, at least 12 to 15% of the women will experience this problem. Then 10 to 20% of the people will have fertility issues. See, oligomenorrhea is very very important, that's why. So it is a very important sign of some underlying disease always. So you should rule out that disease. Hypomenorrhea already I told, very scanty bleeding, even less than 30 ml bleeding per menstrual. Some will tell only spotting happening. They will tell there is appearance of blood, after suppose the previous period LMP, what you say. So she may get after 40-45 days, but there will be only spotting for quite 1 week or something, and again disappeared. Okay, there will be no proper bleeding at all. So this you can correlate with the hypomenorrhea. So oligomenorrhea and hypomenorrhea both are very, very important for Artava kshaya, to understand the Artava kshaya. So in general, what it we have already mentioned, usually Artava kshaya can be a symptom in many other any other condition. So most common one is polycystic ovarian disease. Then there can be androgen secreting tumor of the ovary. Then there can be cyst, also ovarian cyst can also be their chances. Hypothyroidism, then pelvic inflammatory diseases. So so many other conditions, and it can also be there is a link between diabetes also along with the periods, because there is insulin resistance happening, which will again disturb the hormonal imbalance. So that could be the reason. Then side effect of oral contraceptive pills, for those who have been taking regularly, oral contraceptive pills for family planning method, even they can have this issue, menstrual issue. Antipsychotics and anti-epileptics. So whenever you're taking the history, you should also ask treatment history, previous treatment history. No matter what the lady was suffering from, always take the history. There can be anatomic problems, some fibroid or polyp, something obstruction in the uterine endometrium, this one. So that can also be there. Then primary ovarian insufficiency, which will again lead to hormonal imbalance. So that's why. So these all can be there, but most commonly PCO or any ovarian cyst, or this one hypothyroidism, or you can say any anatomical related. So always you should do for the investigations, go for the investigations to detect all this. So I will also share the list of investigations, but before that you will have to take a proper oligomenorrhea, pattern can be different from every it can differ from patient to patient. Okay, every oligomenorrhea will not present with the same symptoms. Okay, even in the bleeding the pattern will be different. Okay, so you should question properly, you should take, always maintain a proper record. See, you start maintaining the record, then only you will know which medicine is working, which what. Oh, for this patient I had given this kashaya or this panchkarma treatment, so this helped. So after 10 to 20 patients, you will get an idea. Oh, this age, uh, the patient from this age range, so I have to give this kind of treatment. And whether the patient is obese and all, so everything, it is not only the only menstrual history. So always document. Maybe I think next class only I will tell how to take the history, because it is common for all the Artava Vyapar. So better I will tell you in detail how to take a menstrual history. Okay. So now regarding the menstrual cycle, when you're questioning menstrual history, so ask the duration of the menstrual cycle, how many days the bleeding will be. Okay, so the days of normal flow of menses in it. Okay, then the number of pads used per day, and the interval between two cycles. Always, what is the gap of the interval between two cycles, and regularity. Suppose previously, always take the normal part also. Don't only uh, focus on the abnormality. Oh, she will tell from 1 year I am having this issue. Also ask her when it was normal, how was the flow, how many pads per day, how many days she had the bleeding, and the interval. Okay, so that also you take and compare with the current abnormality. Okay, so always question, make a proper history document, always maintain a file. Okay, then what all the blood tests you should know, take a screenshot of this. Okay, anyways you will get the recording, but you can take a screenshot, and always you have a habit of writing notes on yourself. Okay, no matter how much we send the recorded videos or we send the PPT, this PPT will be shared. Today only I will share in the group. But still, always make sure you are writing, you are maintaining one note. That will give, more, knowledge. You will remember for long duration. Okay. And you can refer easily if you are making a note, if you are keeping the book in your clinic. So whenever you get doubt, instead of googling and all everything, you keep revising the books. Everything will be consolidated in one book. Okay. So these are all the FSH levels, TSH levels, then thyroid profile, then CBC, prolactin, then LH, all the hormones, luteinizing hormones, then estrogen, progesterone, even HbA1c, because it has the link with the, when you're ruling out the, diabetic, this one, at least if the patient doesn't have diabetic history, at least go for random blood sugar. Always go for, you know if the patient has come for the first time, previously she has not done all these things, or suppose previously she has visited allopathy doctor, but the tests are beyond 1 year and all, beyond 6 months or 1 year, please redo the tests before planning for the treatment. At least very common ones, you should go for these things. Okay. CBC also very important, whether to know Dhatukshaya Janya, whether the patient is anemic or and all. Further, there and you can also go for ferritin, iron studies and all, depending on your yukti. Okay. Again, what is the underlying this one? So, sonological eye investigation, the most common one is ultrasound scan. This is the first very basic this one, because you have to know the what is the status of uterus, endometrial thickness, then ovaries, what is the, is there any issue with the ovary, is there any cyst, simple cyst, chocolate cyst, or any polycystic ovary condition is there, whether the endometrial thickness is, why it is not happening, whether the endometrial lining is happening or not. Okay. Properly. Most of the cases what I am seeing nowadays, uh, there is no formation of endometrial lining only. Okay. There will be history of 4 5 months amenorrhea. When you check the scanning, the endometrial thickness will be only 5 mm. Okay. So that is very, very important. You have to boost that endometrial thickness, right? Then if any other growth is there, fibroid is there, polyp is there, that is also very, very helpful. Further advanced stages, suppose you suspect of any other major diseases, then you can go for CT scan, because especially it is helpful in the adnexal or adrenal masses to know that, to rule out that one. Then MRI pituitary, if there is any prolactinoma and all, then suppose prolactin level is increased, in such cases you can further advanced investigations only. So you can also go for the biopsy and all, if there is any if there are any signs and symptoms of pelvic inflammatory diseases. Okay. See, oligomenorrhea, if I already told, arthakshaya, if left untreated, it can lead to, major this one. So this can lead to infertility, because what happens, uh, if suppose the patient is having a PCO problem already and amenorrhea for long time, then what happens? There will be primary ovarian insufficiency because of the anovulation. Since there is no periods, and or even if the periods are happening irregularly, there can be anovulatory periods. Okay. So this will disturb the endometrium further, and this can lead to the infertility. Okay. And also endometrial hyperplasia, then it can even lead to endometrial cancer if you are not uh, treating it properly. Okay. So then osteoporosis, because of the, see, main source of this one estrogen in the body is ovarian follicle. So ovarian ovulation is also not happening, there is anovulatory condition. So this will also lead to osteoporosis. So cardiovascular problem also, because estrogen is one of the very important factor for cardio protection. It is a cardioprotective agent. So if there is no estrogen, then this will also lead to the cardiovascular problems. Then neuropsychiatric complications also. Okay, so it can lead to that one. So always plan for the earlier intervention. So now coming to the Artava, see in detail also I'll be taking, PCOD, everything, hypothyroidism, everything. But for now, in general, Artavakshaya Chikitsa, we will see, because again, case to case, Artavakshaya can only be a symptom in many cases, right? So you'll have to treat that disease also. You have to treat the root cause also. So, but in general, what can you do? Also, I'll be explaining in the today's class. So, Chikitsa, like Samprapti has two Samprapti, I have already explained. One is Marga Avarodha Janya Artavakshaya. Second one is Dhatukshaya Janya, Artavakshaya. So if in case of Marga Varadha Janya, if you assess, if you feel there is Marga Varadha Janya cause is there, so your treatment should be for Vatahara and Kafahara mainly, and Pitta Vardhaka you have to plan, okay, which will boost the Pitta, because Artava is Agneya, so Pitta Vardhana and Kapha and Vatahara line of treatment you have to plan. Okay, so if you see majorly kapha, if the suppose I have mentioned it briefly there, I'll explain in detail. So kapha means snehana, svedana, and vamana. Vamana is the best treatment. Suppose if you see more of vata, niro and anuvasana basti, uttara basti can also be given if endometrial to promote the endometrial thickness and all. So lining you can give that one. So in dhatukshaya janya tatra samshodhana mevacha. So samshodhana for actually this one, what margavaradjanya agneyam dravyanam vidiyat upyoga. So agneya dravyas for dhatukshaya janya, and also nidana parivarjana should be done. Okay, this is Sushruta Sutra reference 15th chapter. Okay, so see in either of the condition, pitta vardhana should be done definitely. Vata kapha hara only you have to plan. So which is also ushna tikshna deepana pachana. See, metabolism would have disturbed, no matter it is related to reproductive system, hypothalamo pituitary ovarian axis, but gut health is also equally important, because rasadhatu, the first dhatu formed is rasadhatu. Okay, so if rasadhatu is not getting formed properly, means the metabolism, even jatragni also should be, you should rectify that also. There will be some agni mandya at that level also. Then especially when you are talking about samshodhana, they have told samshodhanam iha vamanam na virekah ityapare. Especially Dr. Dalhana, he has told, if you are going for samshodhana, then it should only be vamana and not virechana. Mostly in the initial stages of our practices, including myself, no, I was planning only virechana. Virechana, Artava, Agni, so Pitta only I was thinking. But you should go for Vamana Karma, because if you are doing Virechana, further reduction of Pitta will be there. Okay, Pitta may not be, V-shaped. So you are further reducing Pitta, and it will reduce the Agneya, furthermore Agneya Prakriti will be reduced. So again, it may not be effective. It may not give any side effect, maybe, but it may not be effective, and the oligomenorrhea, the Artavakshaya will be continuing. The patient may continue to have, amenorrhea. But whereas if you give Vamana, okay, Vamana, it will do Kapha ahara, and also it will, what it will do, Saumya Dhatu will be Nirharana of Saumya Dhatu, and Agneya Dhatu will be, Agneya Prakriti will be increased. It will promote. So especially obese patient with the PCO condition or hypothyroidism, no, firstly you have to plan for Vamana. So before planning Vamana, a few more things to add on. If Staulya is there, if you think the person is Kapha Prakriti, then please note down whatever I'm saying. It's not mentioned here. Suppose the patient is, Staulya, Kapha Prakriti, and if she is not had for many months, periods, then go for Udvartana initially. Do some, this one also, what? Weight reduction also. You should have take care of kapha and medas also. You can plan for churna pinda sveda. You can plan for udvartana. Then followed by vamana, and make sure you are giving good dipana pachana dravyas during this period, udvartana period only. Then plan for vamana. Okay, classic vamana. So you can also, in general, you can also plan for tila masha. Ghar mein aadat hai na, you would have seen in your household, this one only practice. If you are not getting regular period of, if any other girl is not getting proper periods, they will give til kashaya. That's very common, or tilka laddu. That is very very commonly used. Okay, then even Maharshi Kashyapa has told Anuvasana is one of the very effective treatment, he has commented. Then Kalyanaka Gruta is very very beneficial, this one also. Then so proper planning has to be done. After Vamana, you can also plan for Basti or Uttara Basti. Give a gap of 9 to 15 days. Then you can plan for Basti also, depending on the patient. You can go for Kshara Basti only, Lekhana kind of Basti only. Okay, that will also do Vata Hara and Kapha Hara. That will stimulate the, again, periods also. So then Shamana Ushadis, what you can plan. See, in further detail, I will tell disease wise extensively. I will take class for PCO, for hypothyroidism, and further even menorrhagia, asargdara, everything I'll be taking. Okay, but in general, I am telling all these things. So you can go for Tila Shelu, Karavi Kwata. Very common, tila kashaya, tilka laddu and all, along with that sleshmantaka, what you say, and karavi is krishna jiraka. So if you don't get sleshmantaka is also fine. So you can tell the patient to take tila and krishna jiraka and make the khada of it. Okay, so you can tell the patient to take 40 ml daily. In the early morning only, let the patient take, along with the guda can be one of the good anupana. That will also help in the, that is also again ushna in virya. So it will also promote the this one, what periods. You can ask the patient to make laddu also with the tila and krishna jiraka and guda. That also can be done daily. You can ask the patient to take one small laddu around 10 to 12 grams daily, one or two, depending on the patient severity of the condition. Okay. Then one more is Krishna Tila Kwata. Then Mishraya, you can also add that Mishraya, that sweet. Shatapushpa also you can add chuna in that kashaya when you're doing. Okay. Shatapushpa again is, Vata Kapha Hara. Varnadi Kashaya, you all know, especially in the Staulya patient, it is very, very beneficial. So Varnadi Kashaya, you already know, it is highly recommended in weight loss cases, because most of the Kshaya people will be having obesity as a problem. So along with that, you can other medications. You can always go for Varnadi Kashaya. Then Saptasara Kashaya. See, it is very helpful in Gulma. I mentioned in Gulma, it is very, very helpful. So if any, fibroids, or if any ovarian cysts and all is there, so Saptasara Kashaya is very, very helpful. And also Saptasara Kashaya, it is very helpful in dysmenorrhea. Suppose a patient is already having oligomenorrhea, but whenever she is getting periods, so Saptasara Kashaya is also equally helpful in the dysmenorrhea cases. So suppose the patient is having bleeding once in 2-3 months, but associated with severe pain and all, abdominal pain, cramps is there, back pain. So Saptasara Kashaya is very, very helpful in that condition. So you